Look younger, feel better. Medical Spa of Midland.
Welcome to Medical Spa of Midland. Today we're going to talk about concierge medicine.
Concierge medicine is about having your doctor available 24 hours a day, 365 days a year. It's about many things. Proactive medicine, where you can have some tests run that are not normally done until you already have symptoms. By that time, it's usually too late. So we try to get you a full physical every year, a little bit more in depth than most physicals, but mostly just where you can be seen when it's your time to be seen and you don't have to wait several hours. If you need something, you're out of town, you can give us a call. If you need something on the weekends after hours, you can give us a call and we can accommodate you if possible. If doctor feels like you need to go to the emergency room, well then you've got your answer. You don't have to go sit for hours in an emergency room unnecessarily, just for cough, cold, sinus infection, etc.
The way insurance companies have been treating physicians as well as patients has been very frustrating to most of us as physicians and patients as well. For example, if you come to my office and I feel that we should do a CT scan of your abdomen, for example, and I feel that that will help me diagnose and treat you better, so I have to call your insurance. So somebody in my office has to call your insurance, get a prior authorization, and if they seem it necessary, and the person on the other side of the phone can be a nurse or not even a medical person. All they have is a checklist in front of them, and if you can confirm that checklist, then they will approve, otherwise they will disapprove. So basically, someone else who's not a doctor or even a nurse making the medical decisions for you. That was very frustrating. And if I want to prescribe a certain medication and it's a brand name medication and it's expensive for the insurance to cover, they will refuse it, they will deny it, and they will ask us to try this or this first. So basically, someone else was dictating what I should do for my patients, and that was very frustrating and is very frustrating. My goal is to spend time, and that leads to how much time can I spend with my patient. In the current system, the recommendations are if you see one patient and you take more than 7 minutes or 10 minutes, then you're losing money. The current recommendations are you go to different seminars, they will tell you that if there's a patient who has a list of problems and you tell them, okay, we will address your number 1 and number 2 problems today, then you make another appointment, come back, and we will go to number 3 and number 4, because you don't have enough time to see that patient. From a business point of view, you have to see so many patients to cover your overhead and all of that.
And so how does concierge medicine differ from that?
So the reason why I moved to concierge medicine is because of this, all of the above. Number 1, I can spend as much time as necessary with my patient. Is 30 minutes, an hour, is 2 hours. It doesn't matter. I will take the time to sit down and discuss every issue that you have, your dietary needs, your needs, that what kind of exercises you should be doing. Basically, I hold your hand and take you through on this path of health and wellness, which is really my passion. If you need to be seen every week, I will see you every week. We have certain patients that I've asked them to come in once a week to have their blood pressure and the weight and all these checks. But as often as you need to be. And also, not only that, but my patients have my phone number. They can contact me, text me, email me, call me 24/7. 7 days a week, 365 days a year. I have a staff of about 4 people who are dedicated for this program alone. Excuse me. If you are a concierge client, you don't have to go through the receptionist and get put on hold. You call my nurse directly or call me directly. If it is a weekend and you are in town, it's a Saturday night, and you think that you're sick, and your choices are either go to the emergency room, wait 5 hours for a prescription of antibiotic, or you can call me. And if I feel comfortable that I can treat you over the phone, I'll treat you over the phone. If I think you need to be seen, I will come to the office, meet you at the office, see you at the office. Or if it has to be a house call, I will even make a house call in certain situations. If I think it's an emergency, I will tell you that you should go to the emergency room if it needs to be. So whatever it takes, I'll take care of you, and you don't have to wait for 4 or 5 hours. If you're out of town and you're in Dallas or New York or LA, and you feel like you have a sinus infection coming on, or a sore throat, or it's something simple, you call me and you give me find a closest pharmacy where you are at, give me the number to the pharmacy, and since you're my patient, I know you very well, I can call in a prescription safely, and you can just come. You can go there, pick it up, and start taking your medicine.
Your vacation.
Continue your vacation instead of trying to find a doctor or an emergency room and waste several hours. So there. About over 10 years ago, I was working a lot, gained a lot of weight, got fat and happy. Not happy. I was miserable. I was working. I would go home and just lay down basically in my recliner and flip the channels and watch TV and drag myself to the dining table and eat. And I mean, it was not. I was only 38 years old, and I felt like I was 138 years old. But then I decided not to feel that way. I lost about 50 to 60 pounds, lost about a foot in my waist, and now most days I will go home and I will work out every day, and I try to eat healthy, and the result is self-evident. I feel great, I feel much better, I've lost weight, and I'm more active and more productive. There are several models of concierge medicine. There are some physicians who will practice, they call themselves concierge doctors. But if you look at their model, basically what they do is they will take a small annual fee for you to register, but then they still use your insurance every time you go see them. They still bill your insurance, and the same hurdles, the same frustrations are there. You are paying an extra amount of money to be their patient, but everything else stays the same.
So essentially, you're paying deductible twice.
Pretty much.
Yeah.
And I don't agree with that model, because my frustrations are with insurance companies, and I cannot do what I want to do when insurance companies are involved. So that's why I decided not to go with that model. Our model is that you pay us a yearly retainer, where you pay us in the beginning of the year, and everything that we do in this office is covered under that retainer. Not only that, but we will give you the what we call the super bills, where everything we have done to you, your labs, your stress tests, your whatever we do, we'll give it to you, and you can send it to your insurance, and if they cover it, they will send you the money, and it's yours. You keep it.
proactive medicine is checking things out before there's a problem. Okay, there are several diseases that once you start having symptoms, it's almost too late. Reactive medicine, like I said, is where, well, I've already started having chest pains. Well, then you've already got the disease. It's already progressed to a dangerous level, where if we can do some tests beforehand and catch it, say, okay, you're getting in a dangerous zone. Now's the time. Let's pull you back. Let's see if we can reverse the process. Diabetes is one of those things. People say, well, I was diagnosed with diabetes. We didn't just get it overnight. It's a progressive thing. And then if you do those tests and realize you're really close, well, we can put you on the course to bring you back where you don't become diabetic.
If you buy a very expensive car today, you will not wait till something breaks down to take it to your dealership. You will take it to the scheduled maintenance that, every 3 months, 6 months, whatever it is. Mm-hmm. It doesn't matter how well your car is driving and you're satisfied with its performance, but you will make sure that nothing will break down in future, because it's a very expensive car and that is the way to do it. But when it comes to our health, which is, I think, is our most precious asset, I think that these bodies are more valuable than any Ferrari or Bugatti or anything that you can buy. We treat our bodies, our health. It's not on our priority list. We wait and wait. People just say, "Oh, I don't like to go see a doctor." Well, that's okay, but then you pay the consequences. So, proactive medicine. Coming back to it, what I like to do is I like to do tests and checkups and annual physicals to make sure that you stay out of trouble, you stay out of the hospital, and you don't have to see a cardiologist or a neurologist for the rest of your life. Once you start having symptoms, then it's too late. Then you have to go see a cardiologist, because the problem is significant enough to cause these symptoms. So that is the goal, practicing proactive versus reactive. Fix it when it's broken. That's not.
And it's always easier to maintain your health than to try to
Absolutely.
recapture it.
And coming to that point is, most people think they're doing the right thing, but of course they're not physicians or medically trained people. It's just like going to a personal trainer or a chef, or you may think that you're doing the right thing, but those experts in the field will guide you better, and you may be doing something very wrong.
My name is Larry Mills. I'm a patient of Dr. Syed in his Concierge Medicine program. I'm very happy with this. I'm very happy that we have this in Midland. I've been to the Cooper Clinic. I was scheduled to go back next year, but felt like that was too long to go, so decided to do this. We saw it in the newspaper. Saw an article in the newspaper about it, and that's what prompted it. We had been looking for a concierge doctor for some time and did not realize that Dr. Syed was going to do this. Testing is thorough. The results have been as expected, and just confirms that I need to do a better job of taking care of myself, which hopefully with his help we'll do that. Oh, the staff's been very pleasant. The staff is very pleasant. It's very comforting. I've had some illness over the last year, had no idea where to go to the doctor. You can go to the emergency room, or you can get in line to see an internist. They're just not real good options. This was the option that came along that fulfilled our need for sure. But the responsiveness from the nurses has been great. I think it's fabulous. Actually, this is better than the Cooper Clinic in terms of time spent with the doctor. You're not queued up with somebody. You're not, it's not an all-day process. It's broken up. It's just very convenient. If you're still working, as I'm still working, it's worked out very well for me. Absolutely, I'd recommend this program to anyone that is looking for a concierge program.
Look younger, feel better. Medical Spa